Hello, everyone, and welcome to the Healing Conversations. And you're with me, your counselor, Catherine. In today's talk, we are reflecting on mental health for all. Today, 10th of October, it's World Mental Health Day. And the theme for this year is in reflection with the COVID-19 pandemic. How many people have been affected by COVID-19? The response is simple and straightforward that almost everybody has been affected by COVID-19. You know, some people may say, no, I was not ill, I was not infected, but we are talking about the effects, we are talking about the impact of COVID-19 in reflection to this. Now, listen to this. Young children have been affected. Old people have been affected, or elderly people have been affected. Young people or middle-aged people, almost everybody has been affected by the COVID-19. You know, I know a lot of people that have lost their job due to COVID-19. Companies have closed because they couldn't continue anymore. They had no source of funding, thereby they couldn't pay their workers, and the companies have closed. There was a time I was listening to the radio, one of the radios, saying that big organizations that fund different organizations worldwide are failing to do fundraising programs properly because of COVID-19. And because of that, a lot of organizations are struggling today because they don't have enough funding to sponsor countries and even to pay their workers. But also think about people that have been evicted in their own homes because they couldn't pay rent. They've lost their job, they have nowhere to stay, and the landlord wants their money. And in the end, they end up in the street. But now let's come closer. Find that in our country, there's a lot of teen pregnancies. Now, this is what I say most of the time, that a teenage or a girl does not get pregnant by herself. It means there's also somebody else who has done that, who has impregnated the girl. But this has caused to a lot of girls dropping out of school because they were not in school. The schools were closed, and a lot of young people don't have much to do in our country apart from just waking up and just sitting around the roads and do nothing, really not being productive. What else could they have been doing? You know, a lot of people end up being pregnant. Now, this has pushed so many problems around with girls. Girls are already vulnerable to so many things. But we are talking even further that there's been a lot of early marriages. Yes, some marriages that maybe they did not plan, but in the cultures, some of the cultures, a girl cannot be pregnant and stay with her parents. They'll push that child into an early marriage because they don't want to take care of the child and her unborn child. In the end, they'll push the child into so many problems. A lot of young girls are facing domestic violence because of that early marriage, teen pregnancy, and they are not prepared for that, and even just pushing their poverty into higher level because they just don't know what to do with their lives. They have nothing to do. All they know is that they are pregnant, and they are not even prepared for the marital life. So all these things are happening due to COVID-19. They might have been there before COVID, but you find that the rates now, the numbers have increased because of COVID-19. There are so many things that are happening. What about the anxieties? What about the fear that has come with COVID-19? I remember during this period, especially in our country, Malawi, there was a time I had flu, and my husband also had flu. And then one evening during the prayers, as we were about to go to bed, one of our youngest child, she was praying. And in her prayer, she said, Lord, please heal mom and dad because they've got COVID-19. As funny as it sounds now, but at that time I was so touched because I thought, what is it that is going on in this child's mind that she should be convinced that we've got COVID-19? That was fear, because the message was COVID comes with flu-like symptoms. And here we are, all parents are down because of flu. It was a normal flu because we got better by the end of the day after taking some, herbals and whatever we're drinking. But to her, in the mind, the fear that she was going through, I can't imagine, because you can't just dispute to her to say, no, it's not COVID. Because in her mind, the way she's thinking both mom and dad has COVID-19. Now, we are looking at the impact of COVID-19. If we are not careful, if we cannot make mental health be accessible for all people, the end result will even be harder and even more difficult than what it is now, because the impact is not just felt now, it's not just immediate, but it's in the long run. Think about all those unborn children that have been think about all those unborn children. Where will they be in the next few years? What will they be doing? What about their mothers? Think about all those job losses. Have there been any job creation recently? You find that a lot of things that are happening for somebody who has lost a home, has lost almost everything, to go back to the state whereby he can acquire almost everything. It's not an easy thing. So a lot of lives have been changed, but in all, you find that mental health is less talked subject in many countries and in many facilities. What if our governments would even invest in mental health facilities? Imagine have people who are qualified to work in mental health facilities elsewhere, so that people can be able to access mental health, the way you can access your physical health treatment or help when you go to hospital. Even sexual health, if I have something sexually that is concerning me, I can walk in to a hospital and explain. As embarrassing as it may be, I'll go and explain. But it's so difficult for mental health to go and explain because of the stigma that is attached to it. And in our country, the institutions that are there, maybe about 2 or 3 that are well known. In courts, we think about all those people that are institutionalized, that are on heavy medication because of different disorders that they've got. But what about somebody who feels like, okay, I'm normal, I'm okay, but things are not working? There should also be that time where you can go and access that treatment. We need to invest. We need to ask our countries to invest in mental health services. That will be very crucial, because at the moment, as I've said, just look at the impact on individual, the things that we have talked. You find that they are big and they are so much, but you find that there's the little things or little known facts about mental health. We don't talk much about it. As much as we are focused on vaccines, we are focused on our physical health, but we should never neglect mental health. That's why in today's reflection, we are thinking about mental health for all. Despite all what COVID has done, there should be a moment whereby I can walk into any facility and access mental health services. You should be able to talk to somebody. Speak about your worries, speak about your anxieties, talk about what you're feeling. That should be able to help people, so that people should be healthy. Remember, there's no health without mental health. Thank you so much for staying there and listening to this presentation.